we bring together patients, people that have been patients, so young people that have finished their cancer treatment, their families, their siblings. We've had families who have lost children through cancer, who've been bereaved through cancer as well as part of these groups. And they come, sit together, work together, and work with the researchers to ask questions and to answer questions. They'll often ask about why is this research happening and what way is it happening, and then they'll tell the researchers how to do it better and how to do it differently and which bits will work and which bits won't work. There will be lots of conversations around the difficulties of going through cancer treatment and why these are the things that you should be looking at in research. What you'd see would be a bunch of researchers dressed in normal clothes, often sat around a table that is covered with bits of paper, with kids doing colouring or sticking things down, grown-ups fighting over the last googly eyes because they want it for their monster, and this hubbub of activity and conversation. You might see us handing out champs pounds and people deciding very earnestly where they're going to spend this paper money going forwards with research, or having people that have travelled halfway across the country to get them to talk about how does it feel when somebody says to you that you haven't been taking your medicines properly, and how can we do that better to encourage people to take their medicines properly. You've got this enormous great activity going forwards that is about drawing the expertise and experience of both sides, of the parents and children and the researchers together to make this research better. And what we've done here in the Candlelighters Square and the Candlelighters Supportive Care Research Centre is advance this in ways that we really haven't seen in children's cancer work anywhere else. I spoke on a previous video about the fact that statisticians are getting excited about this. I'm the supervisor for a PhD for somebody that is working in Barcelona. Because of my work in patient public involvement, they reached out across the English Channel and jumped over France to see if I could be part of that work with children and young people and supervising their PhD. And what we've done is put this at the heart of what we're doing in the research centre. The very first piece of research that we did was to go out to people and say, what of these 20 different areas that we could research in supportive care, what is the most important to you? And we had ways of doing it with ranking them. What's the highest, what's the lowest? We had, here's some champs pounds, go and put your money on the most expensive ones, the ones you want to pour the money into the most. We had young people going from a double thumbs down to a double thumbs up on the importance of these things going forwards. And we've got all of that information and crunched it down into an infographic that's actually really easily available and tells you about it. So we've done something academic with it, but that academia has also then pushed us to say, where is it that we should be doing this research? Where should we be taking our ways forwards, and how do we make these things work better? Because it has made a difference. We did a research project on photobiomodulation, this red light therapy to make things better for mucositis when you get really severe mouth ulcers. And one of the things that research before this had suggested was that it was quite scary almost to have this thing done to you. And young people said that they'd quite like to do a video to explain it to folks so that they weren't scared when it was happening. And what we got was a load of kids that had experienced mucositis who came into this very room and sat down and told us how we should storyboard this, how we should put the information across, what were the really important things to do. And that came from conversations with them, and we found out all sorts of things. We went into it absolutely convinced that we should have a young person narrating how this worked, and they were very clear. They did not want to hear from an 8-year-old or a 10-year-old about how the science worked. They want someone that actually looked like a dentist or a doctor telling them about that bit. But they also really wanted to hear from people that had had mucositis and had photobiomodulation. so that they knew that real people, not just doctors, were saying it didn't hurt and it does make a difference and it did make me feel better. We've done that with other research studies as well. We've got all the nausea and vomiting stuff. We've worked to see how might we use live theatre or XR and AR going forwards. We've had people come from literally other places in the country to come and take advantage of this group because it's so difficult, they find, to get these conversations going. And here in Candlelighters, there's a bunch of people that wants to do this, wants to advance things and want to make things better. It has improved research projects here and in other places. It's contributed to them getting the grants and putting things into practice. And I think it's also been really, really enjoyable for the kids that have taken part. And the grown-ups to a very large extent as well. And so we think that this, even if all it does is make the research go in the right direction, is a really, really important thing to do. You can waste money doing research on things that doesn't matter. But if you've got a bunch of people that have experienced it telling you that's important, you should really listen to them. And you should really go on with what they think's important, as long as the researchers think it's doable. And that's what this group does.